Hi, you guys. It's the Millennial Professor here, and my name is Dr. Kia Lewis. So, I have been a nurse for 11 years now. I originally got my LVN in 2011. I transitioned and did the LVN to ADN program, and I graduated with my RN, and that was in 2013. In 2014, I graduated with my bachelor's degree, my bachelor's of science in nursing. And then in 2016, I went to school. I graduated with my master's of science in nursing degree. And then most recently, I got my doctorates in nursing, which is a DNP. And I just got that in 2021, in October of 2021. So, my experience in nursing, I have done long term care at skilled nursing facilities, which I absolutely love. That's my passion, the geriatric population, working with geriatrics. That is one of my passions in life, in addition to education, of course. I have worked at a community health clinic. I've had experience in home health nursing. I've also had experience in working in medical surgical nursing or med surge, and then I have also worked in a step down unit in intermediate care. And then most recently, my experience is radiology nursing. In terms of education, I have worked as a preceptor for many years. I mean, right when I got my RN, like 3 months after starting on the floor, I was already precepting new nurses and new trainees, and even precepting student nurses who were coming onto the unit. And that's when I really found my passion in education. And I was like, I kind of like, training people. And so this is something that I could possibly do. And so that's really how I kind of decided, to go into getting my master's of science in nursing and education instead of nurse practitioner, because I know that the nurse practitioner program is so big and all of the nurses are doing it and it's the it thing to do. But my passion, and I really just went down the education lane, and I'm so glad that I did. I absolutely love educating. I love working with nursing students. I love working with new nurses. I love talking to younger kids who have a passion to be a nurse when they grow up, and I just love talking about it, and it's just something that I love to do. Most recently, I have been working as a clinical assistant professor. So I'm a full-time faculty member at a university. I work at a college of nursing, and I've been doing that for almost 6 years now. I can't believe it's been all that long, 6 years. But yeah, it's been almost 6 years that I've been working as a full-time faculty member, and I even now, I work, I got my DNP, and so, I was trying to really see what route I was going to go with that in terms of PhD, EDD, DNP. But I found the program, the DNP program that I needed. It was completely online, 100% online. The courses and everything was manageable. And so I ended up getting my DNP in educational leadership. And so now, that leads me to why I am here today and why I have decided to start this YouTube channel. I feel so confident in my abilities now. Like I said, I have been working as a nurse for 11 years now. I have been working in education for 6 years now. I have been a preceptor for, working as a preceptor for like 8 years now. And now that I work in academia and I'm finished with school and I'm trying to really find my path and find what it is that I like to do and that I want to do, one of the biggest challenges that I'm seeing right now is in academia is students and them really needing assistance with they need mentorship, they need professors who care, they need professors who can motivate them, and professors who can empathize with them. And so, in nursing, we know that nurse education, there's such a shortage of nursing faculty. Not many younger faculty or younger nurses want to get into nurse education, and it's because the pay is not there. Especially when you compare it to other professions and when you compare it to being a nurse practitioner or a nurse anesthetist, the pay is not there. But when you find something that you love and that you were really designed to do and walk in your purpose, then that really doesn't matter. And so one of the things that coming back around to what I was talking about and why I'm starting this YouTube channel is because nursing students need someone who understands them, and also someone who needs to meet them where they're at in the classroom and outside of the classroom. A lot of our nurses, again, I mentioned the nursing education shortage of nurse faculty members. We have a shortage of nurses, but this profession is not going anywhere. Nurses are in need. Patient care is complex. And so I recognize that, the traditional classroom, working with faculty members who are about to get ready to retire and probably haven't been in the bedside or even connecting with patients in so many years, that does our students a disservice. And I am passionate about my students, and I'm passionate about you as students, and my goal here is to equip you with the knowledge and skills and techniques that you need to be successful in nursing school. Even if you are already a nurse and you just need guidance, if you need to talk about what different avenues you can go through in nursing, because being a nurse doesn't just mean that you have to work at the bedside. There are so many different things you can do, from like case management nursing. They even have MDS nursing, nurses who work in MDS. We also have nurse education, nurse administration, executive nurses, clinical nurse specialists. The disciplines are endless. The different types of specialties are just like endless in nursing. And if you want to know about different disciplines in nursing or different specialties in nursing, then I can do another channel about that at a different time. But again, I just wanted to introduce myself in this video, really put myself out there. This is not something that I'm usually doing. I'm not someone who's just camera friendly or photogenic, what have you. And so this is something new that I'm trying, because I realized that in nursing education we have to make a change. And I recognize that my students, they are millennials. A lot of them are transitioning Generation Z students, and so we have to meet them where they're at. 3-hour, 4-hour lectures are just not doing it anymore. And what do we do? What does everyone do? Everyone's on their phone. Everyone is scrolling through social media, TikTok, Instagram, all day long. Probably not so much Facebook. I don't know. But I recognize that it's things like this and content like this that really resonates with the students. And so, as I begin to try to develop content for this page, it would really be great if you all could help me with ideas and help me with things that you would want to know. Because again, this channel is for nursing students. This channel is for children who have an interest in nursing. And then also, this is for my fellow nurses, my peers, and my colleagues who want to maybe learn more about nursing, the different disciplines in nursing, or just need somebody to talk to. That's what I'm here for. So just let me know. Again, my name is Dr. Kia Lewis. I am the Millennial Professor, and until next time.